In this video, we're talking about eye floaters, and we'll tell you everything you need to know if you yourself have to deal with them. From their causes and symptoms to potential treatment options, we'll shed some light on this common visual phenomenon coming up. So whether you've experienced eye floaters yourself or simply want to expand your knowledge, you'll want to watch until the very end of this video as we explore their origins and effects on visual clarity, what this all might mean, and then some potential treatments. Understanding these pesky spots or lines that drift across our field of vision can help us better know when to seek out treatment from an eye care professional like an optometrist. Now, the disclaimer here is just that watching this video doesn't create a doctor-patient relationship, and the treatments discussed, if applied, are done at your own risk. That being said, there's a great deal of good knowledge to take away from this video that could help you if you suffer from these pesky eye floaters. And one last very important thing that you should know is that if you're experiencing flashes of light or any sort of a large or small dark curtain coming over your eyesight from any direction in one eye, this might be an ocular emergency, and you'll want to seek out immediate same-day appointment with your eye doctor, because sometimes an increase in ocular floaters can indicate something more serious called a retinal detachment. So have you ever noticed any tiny specks or cobweb-like shapes bothering your vision? These are considered eye floaters, and they're pretty common. Let me know in the comment section if you have eye floaters, but eye floaters are small spots that drift around in your field of vision. They might look like black or gray specks, squiggly worm-like looking lines, or even clouds. They tend to move when you move your eyes and might be more noticeable against bright backgrounds or when looking at a plain white surface. And by the way, watch until the very end of this video where I go over some ways you can make these floaters go away completely, or at least make them less distracting. But what exactly are eye floaters? Well, they're tiny clumps of gel-like material or connective tissue that forms inside the jelly-like substance that fills the center of our eye. This gel-like substance is called the vitreous humor. As you age, this vitreous gel becomes more liquid and begins to shrink and clump together, casting shadows on the retina, which results in the appearance of floaters. And what's funny is that due to the physical properties of light, along with their own visual processing system, these floaters appear like they're actual objects floating around in front of us, an effect known as entoptic phenomenon. While eye floaters are generally harmless, they can be bothersome and affect your daily vision. However, they usually become less noticeable over time as your brain adapts to their presence and they settle to the bottom of the eye. Again, it's important to note that any sudden and significant changes in the number or appearance of floaters, along with flashes of light, vision loss, or a dark curtain coming over your eyesight in either eye, could be signs of a serious eye condition called a retinal detachment or even a retinal bleed. If you experience any of these symptoms, you should seek immediate medical attention by scheduling a prompt visit to your optometrist or retinal specialist in your area. In a great deal of cases, eye floaters do not require treatment. However, if they significantly impact your vision or quality of life, your eye doctor may recommend procedures like laser therapy or vitrectomy to reduce their appearance. If you're bothered by eye floaters, try not to focus on them too much. If you do, it can actually make them even more prominent. Instead, consider techniques like moving your eyes up and down or side to side to shift the floaters out of your central vision, temporarily at least. Now, ocular floaters are often more noticeable when in bright light conditions like walking outside on a bright summer day. So a great way to avoid being distracted by floaters in this situation would be to put on your sunglasses before walking outside. The tint in your sunglasses will make the vitreal floaters less distracting by reducing something called contrast sensitivity. And we've all heard of the many other benefits of wearing sunglasses when playing outside. In practice, I often see patients to do their post-op care after cataract surgery, and although most people are happy with the vision improvement, one very common complaint after surgery is the increase in ocular floaters. And some people might immediately want to maybe blame the surgeon for inducing floaters by performing the surgical procedure, but really the floaters were probably there all along. After cataract surgery takes place and the patient then gets to look through a brand new clear lens implant in each eye that replaced the cloudy cataracts, that patient just got a nice boost to their contrast sensitivity and will then more easily see the eye floaters that were already there in the years leading up to the cataract surgery. Let's get into some possible ways to make these eye floaters less distracting. First one is sunglasses. Like we already talked about, sunglasses reduce contrast sensitivity and make floaters less of a distraction when we're outside. Another way to make floaters less distracting is with supplements and nutrition. A supplement called Vitreous Health by a company called MacuHealth was shown in a recent study to reduce eye floaters in 7 out of 10 people who had them. I'll have a link to this in the description below. I actually did some digging on customer service feedback on this product product and found that it has very high ratings online. Another food that might help reduce floaters is pineapple due to its having a high concentration of a protein digesting enzyme called bromelain. I filmed a video all about this study and what it found, and if you're curious about how much pineapple was consumed in the test subjects and for how long, be sure to watch that video next. The third way to potentially make these floaters less distracting is to talk to your eye care provider to see if you're a good candidate for a procedure known as laser floater removal or vitreolysis, where a special laser is focused inside the eye and used to break up these floaters. And lastly, if nothing else is working and the floaters are causing a great deal of distraction and affecting your activities of daily living, then your eye care provider might recommend a surgical consult for something called a vitrectomy, where the vitreous gel or the gel-like substance inside the eye is completely removed and replaced with a more clear fluid so the eye can maintain its normal shape and form. And that's called a vitrectomy. The bottom line is that regardless of what you end up deciding to do, always keep your optometrist in the loop. Eye floaters are a common occurrence caused by changes in the vitreous gel inside your eye. And while they're generally harmless, it's essential to monitor any sudden changes to your vision. Remember, your very own eye doctor is your best resource for information and advice as it relates to your eyes. Thanks for watching, and if you found this video informative, smash the like button for me and subscribe for more helpful content.